Hit Exchange Media Coverage, HIMSS 11.
Our company's been around since 1999, and we started in the laboratory in the blood bank area of hospitals. And what we saw there was a need to do exhaustive, thorough testing of those computer systems to help prevent medical errors. And now as we move into the era of AARA and CPOE and meaningful use, there's a huge need out there now to apply that same type of technology to the CPOE world to make sure that our implementations are good, because we don't reach true meaningful use until we're sure it's tested and functioning correctly in the hospital.
Sure. How close do you think we are to really aligning with that dynamic? I mean, what are the obstacles or the challenges to adoption that you're witnessing among your partners?
Well, I think it's the same obstacles to doing CPOE in general. You have to get physician acceptance, and one of the biggest hurdles with the physicians is their fear that the system is going to decrease or negatively impact patient care. So the better tested we can have our system, the more functioning we can have it, we can ease that way into physician adoption a lot quicker and a lot easier.
How are you involving practitioners in the process of developing the solutions and implementing it within their organizations?
Well, what we're starting to do is work with a lot of what the Leapfrog group recently reported, where they found in their 2009 study in over 200 of the most connected IT hospitals in the country that over 50% of the routine medication errors and over 30% of the potentially fatal errors are not being captured. So what we want to do is go after those particular combinations that they test for, those 50 most common, and put that into a test set so that each hospital has the opportunity to thoroughly and exhaustively test those, prove that they are working correctly, and that will help the physicians have that confidence that it's ready for their patients.
So what kind of feedback are you getting from physicians, from clients, partners, as far as case studies or specific experiences that illustrate the value of that solution?
Well, at this point we're still very new out there. We're starting with Cleveland Clinic, Bon Secours Health, and Salem Hospital in Oregon, as well as Children's National Medical Center in DC. So we'll be gaining experience with them and feedback from them and tailoring it to go forward. But it's just like the rest of CPOE, it's still kind of growing and building this time. And the nice thing is it's going to help institutions not only for meaningful use stage 1, but it's going to grow and continue to grow with them through stage 2 and stage 3 to help them get those dollars faster, get the adoption faster, and end up with a predictable cost and time and quality every time they put a new upgrade in. And CPOE, to be meaningful, has to be able to be evolutionary. As new releases come out and new technology comes out, we need to be there and be able to implement it safely in order to make sure we truly get the benefit out of it.
Catch the premiere issue of Hit Exchange magazine or visit hitexchangemedia.com for more healthcare technology news and information.